Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Leslie Carmen is here to talk about something new that they're doing now. You know that Leslie Carmen started, I guess, I've known you for now about a year.
Correct.
And you started doing a lot of things. First, it was just for the pain that people came in and you worked on helping them.
Yes.
And then you developed more products, and now you have a new announcement.
Yes. What we would like to announce is Carmen Home Care. And the reason why we're doing this is because I have so many patients that call in and they would love to do laser therapy. But they can't get out of bed because that is exactly their problem. They have bad knees. They have bad backs. Many of the people don't even have, partners anymore. They're older. They're alone. Their children don't live here in Florida. They have maybe someone that's there to take care of them. But these series do require about, 20 different treatments. So that's a big commitment for a patient. So they could maybe come down once or twice. You can maybe find a friend to drive you, or you can get on a bus 1 or 2 times, but not when it's 20 times. And that's really what is required to be able to see a difference, see your body really starting to heal itself. So I was thinking, well, how can we change this? Because I really want everybody to be able to profit from this. What can we do? And we use these devices that are the home devices, but we have the professional series. And it's very easy for us to carry. So it's not this big, device. So for us, very easy to pack into the car, go to the patient's home. And then we do these special protocols. So it's not just treating the local pain. It's also treating the patient as a whole. So many elder patients have depression, or they have irritable bowel syndromes, or they're constipated because they're taking so many medications. So with this, being able to go to their home, we're giving them about a 40-minute laser treatment, and it's with 2 lasers, 2 devices in each hand. So we're literally able to give about an hour and a half of this amazing laser energy, and so we can focus on all various areas. So we'll do the carotid arteries to bring blood flow into the brain, into the heart. We will do the adrenal glands, in the back of the kidneys that support your hormone balance and your fatigue. So many people suffer from adrenal fatigue. So this laser will stimulate that. Then let's say you have a back pain. What we'll do is treat your entire spine. We'll treat any other area that is painful if you have, shoulders or knee pain, anything like that. So we're looking at the entire package and helping reach people that really need this laser and they just can't get to us. So I thought, Carmen Home Care would be the next step.
Well, it is. And as you were talking, I was thinking about this, Leslie, that people who are at home don't get a lot of visitors.
Right.
And the fact that you even go there mentally will stimulate them. And you are so kind and you are so, so sweet and understanding that I can see this being a double duty kind of a visit. You're helping them with their pain, with your equipment, but then at the same time, they can count on your coming. Now, are you the only one doing this in your company?
Well, no, we're going to be training everybody for this. Although obviously everybody's already trained, but this new custom protocol that I'm putting together is going to be more comprehensive. It's going to be also treating scars, because what we're finding is when you have scars in your body, and it doesn't matter what scars, but they hold energetic imprint of that emotional aspect of it. So this sounds very odd, but it really is true when you start researching this. So let's say you fall and you hurt your knee and there's a scar there. And when you fell as a child, let's say, and you fell and you hurt yourself, and suddenly your mom comes and she's yelling at you, why did you do this? You should have been this. You should have been careful. This could have happened. Well, that scar now is really associated with an emotional stress. So we have found that when you give laser therapy to these scars, and you talk about it. So while I'm actually treating the patient over this scar, I'm asking the patient, so what happened when you got this scar? And the patient starts talking and talking and talking and opens up. And literally there's also an emotional release that's attached to that. And you would not believe how many little scars could actually be responsible for pain in a kidney or a head pain. So another patient that I was talking to that I was doing this detox on, where we do, the arsenic detox and all that, she has unbelievable headaches. And we detoxed a lot of these toxins, and yet her headaches were still there, where I usually get an amazing success rate. So I was starting to ask her, well, what age did you start getting these headaches? And she said 11. And I said, did anything change in your life? What happened in your life in that time period? And so we kind of found out that her mother was changing husbands, and those husbands were a little bit of abusive to her. So, and her mother didn't believe her when she talked about it. So that's when the headache started. So there's so many components that, that cause us disease, illness, dysfunction, headaches, all those different things that are also attached to the emotional components. So we need to really incorporate that as well, and not just treat, your back pain, but really understand, where could this all be coming from? How can we address the patient as a whole, his body, mind, soul, spirit, everything, and really understand them. And another patient that I was talking to had a terrible, terrible scar in her leg, really bad scar. And she wasn't feeling that great either, after the treatment. So I said, let me address that scar. It's really big. And I started treating her, and I started asking her about the scar. And she completely opened up about an unbelievable story that I could barely, even fathom how that all came together. She was crying. She was emotional about it. And after I treated her, she got up, she hugged me. She said, thank you so much. She said, I feel so amazing. And she walked out, and her son was there. And I said, we did a little bit of treatment on the scar, just so you know what I was doing. And, she opened up a bit, and he said, she opened up to you? And I said, yeah. I said, we all have never known anything about the scar. So it really, it was years of frustration, anger that she was holding in, that she was able to release, which is just so beautiful. So I'm just so excited that we're able to heal on just various levels. It's not just anymore about, just the knee or the back pain. So Carmen cares about the whole picture.
Well, this is great. I mean, now you've become a clinical psychologist. Well, but you do get intimate when you're trying to help someone with pain, and depending, where it is and all. And you do have that personality, so I could see someone feel safe with you. Which is the whole point. Now, why don't we go back to when you very first started with Carmen Care, and what the lasers really, why you decided, because of your daughter's illness, you did decide to go into this because you were so impressed.
Correct. When Lee was diagnosed with her trigeminal neuralgia, there were two options: surgery, which is brain surgery, or the gamma knife, which is radiation to her brain.
What happened to her when what was that like?
Well, when she basically just woke up one morning with tooth pain, and that tooth pain radiated to other teeth. And so we went to the dentist, and the dentist couldn't really find anything wrong. He couldn't find a cavity. He couldn't find any problems in the root, nothing at all. So my daughter was saying, but I still have this terrible, terrible pain. So
how old was she again?
She was 17. So then we went to another dentist and to a doctor. Nobody could really understand this pain. And this pain developed so that it became so excruciating that she would wake up every morning at 3 o'clock and throw herself on the floor screaming for a half an hour, screaming. That pain would last for 30 minutes and then it would go away. And but this escalated to where it would start being longer. It would happen more frequently until it just was constant. And we ended up taking her to the emergency room. And there finally, I think it took 5 to 7 doctors just coming in and out. Nobody looked at me, just they would come in, they would press her. They would actually press her on the glands, which would trigger an attack every time they would press her. And I'd start saying, please stop touching her, because obviously this is causing something. And, but they didn't look at me, didn't talk to me. After hours and hours, at the end of the day, they came in. Well, actually, they didn't. A nurse came in, handed me a piece of paper saying, your daughter's been diagnosed with trigeminal neuralgia.
And I probably had no idea.
No
idea. It's like I didn't never have an idea.
Couldn't even pronounce it. So I started surfing. We went back to the hotel. They told us.
What did they want you to do then? But
They just said, take her home, go back to, because she was in school in Northwood. In the Northwood School in Lake Placid. So they just said, you have to take her home, take her out of school. This is a serious issue. She's not going to die, but it's a serious issue. Go back home, see a neurologist, and then go from there. So that's what we did. And we took her to the hotel. They had actually given her a shot of something, telling us that this will last for at least 24 hours. She won't have pain. Well, we got to the hotel room. She was sleeping. 3 hours later, again at 3 a.m, she wakes up, pacing the room, screaming, Mommy, Mommy, why is this happening to me? What is this? What is this? So even pain medication does not put a damper on this at all. So I started surfing when I was in the hotel room. And, the more I surfed, the more I cried, because I started realizing, oh my God, this is called the suicide disease. This is so bad. There's nothing you can do for this. So I took her home and I started just researching and just never giving up. I just never gave up that there was going to be hope somewhere, something natural. Because I did grow up in Switzerland and have a medical background there. I'm not a doctor, but I did, a lot of different things. And in the physician's office I worked with, we used natural healing things. So you use herbs, you use oils, you use meditation. So you really try to do things first on a natural level, then instead of something aggressive. And I just believed that I'm going to try that first, because she was on Lyrica on this medication that makes you very drowsy, and it just made her feel like a zombie. And she couldn't play ice hockey anymore. She couldn't go to the beach. She loves surfing. So when you stand on the board, you lose your balance, right? And that, unfortunately, those medications make you completely lose your balance. So she couldn't surf anymore. And I once went to the mall with her to get her out of the house. And after 20 minutes, she said, Mom, I got to get home. I don't feel like shopping. I don't feel like doing anything. So that really brings your whole quality of life to a whole other level. And all she was doing was sleeping. So I said, I have to find a solution. And I did, which was laser therapy. And we did that up in South Carolina. She did get better, and, largely better. So at about 95% better with every month.
So how did you find that?
I started surfing. I went online and I saw that, laser therapy was being used in Russia, in Europe, and that they were having fantastic results with this. So, and I found one place in South Carolina at the time. And I just said, I have to go. I just have to do this. Some people were saying, oh, don't waste your time. It's a scam. So when I went to my neurologist at the time where Lee was being treated, and I told him, look, I found this laser therapy. What do you think? He said, don't waste your time. If that would help, I'd know about it. I'm the specialist. And he kind of got angry. You surfer moms, you're always, and I don't mean to put physicians down. They're fantastic. They save lives. This is not about that. It's just about, we need to open our mind. We need to know that there are other options, Doctors saved my life. I had an appendix that was burst, so thank you. I had a car accident. I needed help. So again, I'm totally not against medicine. We need it. It's fantastic. The miracles happen there too. But I'm talking about...
But nothing was working.
But nothing was working for her. Exactly. Medication wasn't working. Brain surgery, I for sure did not want to do, because the side effects were seizures.
Did they say that they thought brain surgery?
Yeah. And in the meantime, yeah, absolutely. In the meantime, I've become a spokesperson for the trigeminal neuralgia community. I have a fundraiser for TN. I want to really build that up. And my life goal is to have so many funds available that actually everybody could get a laser. That's my life goal. So who knows? Maybe that'll happen.
So nice.
But because you see these people suffer so immensely. It's not like a knee pain. It's like if you have a knee pain, you can sit in front of TV, watch TV. You can put your leg up ice. I mean, of course it's painful. But trigeminal neuralgia is out of the blue. Somebody stabbing you in the face. You never know. You don't expect it. It's not, you can't do anything. There's no position you can take. There's nothing you can do that will just ease that pain, or that you'll know when it happens. So it causes unbelievable anxiety. You can imagine just never knowing when this pain's going to hit you. So that's the whole reason why I got into this. When Lee got better, I remember so clearly being in the hotel room, and I didn't make this a stipulation, but I'm very spiritual, believe in God. And I said, God, if this helps, I'm going to devote my life to helping people. And, a few years later, suddenly I was in the clinic and I was like, wow, this really happened,
That's right.
So it's been quite a journey, but it's been beautiful because we've helped so many people.
And of course, laser therapy has now become the big thing. I mean, for many problems and for many results, people having laser therapy for their skin, for
Correct.
So many ideas.
Yep.
I saw someone getting a treatment to bring back hair.
Exactly. Yes. Well, the thing is, if we understand how our body works, then we understand how laser can help you. So if we go back to conception, we became one cell. That one cell divided into two cells. So you became an embryo, a baby. We grew. What we're sitting here now is with 100 trillion cells. And if you understand that that's all you are cells, muscle cells, bone cells, even cartilage cells, blood cells, everything. You're just cells. How do these cells function? They function by dividing. getting energy, getting ATP, which is a form of energy, into their cells. They start creating, what they do their job, what they're supposed to do. Every cell has a specific job. They need energy to do that job. But what happens is we get stressed, so we get bogged down. We have toxins in our body, which slow down our own metabolism, and metabolism meaning our cells, healing and doing their job. So now our cells are actually so busy trying to get rid of the toxins, trying to get our stress level down, just trying to keep us healthy, that there's not enough energy, not enough resources to actually heal a problem that we have. And the laser energy replenishes that energy of every individual cell. So just to put that, very easy, it's like
Very
basically,
clear.
Putting that energy back into the
Very
cell.
clear.
This way your cells can start doing what they were meant to do, and they have more energy. And so now you breathe better. You have more oxygen. Your stem cell production goes up. And what does stem cell mean? It means that now your body has cells that can turn into anything your body needs. Stem cells become muscles. They become, ligaments even. They become bone, anything you need. So your body knows what it needs, and it will produce that.
And so this whole the laser therapy, when you first started, people came there and they had 20 minutes or whatever it took. And then they came back a few times, and then sometimes it turned in, as you said, really serious cases were 20 times. But then you decided that if you could teach them how to use this, they could do it at home. They didn't have to make that trip to you. That was your next evolution, wasn't
Correct.
it?
Yes. So what we do is we actually educate our patients, because I believe that if you're educated, you're going to be able to help yourself and heal yourself. And we treat with class 4 lasers in our clinic, which have a lot of power, a lot of strength. So for something like spinal stenosis or, very severe arthritis in your knee. So we really boost your whole body with that energy. You start healing. Now, in some cases, patients want to continue that with a maintenance. If, let's say, they're older and they just don't, their body's just hard to, maintain that high level energy all the time. So they purchase this home device and they continue treating themselves. So we educate them in the clinic. We give them the booster, the first start, and then they go home and learn how to do this. And they can actually start treating other things. I have patients that come and they're fantastic at this. Every day they do their carotid arteries and they're feeling better, they're sleeping better. They do their adrenal glands, and then if they burn themselves, they'll just quickly treat themselves. Or if they have one of their grandchildren for a visit and their grandchildren have a tummy ache, they'll treat the tummy. I mean, there's so many things you can do.
Yes. They're going to have to hire them. Let me give everyone a phone number. I know you're saying, well, how do I have this person come for my Carmen home care? So we're talking with Leslie Carmen, and the phone number now is 561-405-9577. 561-405-9577. And it's advanced laser therapy. That's what we're talking about. Now, Leslie, if someone were to call and they wanted you to go to their home, I don't think you can do that for free.
No, unfortunately not.
No, they should come, if they can,
yes,
to your office first.
Exactly.
And then you should get a good feeling about what they need, and can you help them? Maybe you can help everybody.
Mm-hmm. Exactly. That is very true. But I do, if somebody's willing to pay that first visit, I will go to their home.
Right.
Because some people can literally not get out of bed. They just can't. And I don't want them to miss the opportunity to be able to get this healing. Because if they have wounds, some people lie in bed and they have terrible, terrible wounds. And this laser can actually stimulate the wounds to heal and to close. So I would not want them to miss that opportunity. And I actually just got a text from one of my patients who has this laser using it at home. And let me see if I can make this long story into a compact short story. She had needed surgery. So she went to her cardiologist. He was going to clear her for surgery. He took her hemoglobin rate, and it was a 7. Now, normally for women, it's about 12 to 15.5. Hers was a 7. He said, how on earth are you even walking? How are you even functioning? And she had called me a month before and said she was going to have surgery. I know her very well because she has other things going on. I'm always giving her custom protocols. I said, listen, you're going to have surgery. I know your problem. Treat this, 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 and this to prepare your body for the surgery, to give you that extra energy boost. Well, that's why she was still able to function at a 7, because what the laser does is give that energy to those cells, that oxygen that you normally get from the hemoglobin. So she was getting that from the energy of the laser and she knew that that was the reason, because years before she had a hemoglobin of 9 and was practically not able to walk or get out of bed. And at a 7, she told me she was still doing 10,000 steps a day. So that's unbelievable. That's literally proof right there for you.
Wow, big story. That's a great story. Let's give you the phone number again. It's 561-405-9577. There's all sorts of pain. We hear so many people have migraine headaches. We have nerve and joint pain. People who have suffered through chemotherapy, they wind up with all sorts of neuropathy. And
correct.
And then there's also, someone, I was just thinking about what you said, somebody who's maybe been in an accident.
Absolutely correct. Yes.
And maybe they themselves haven't been very affected, just minimally, but this could probably help them because mentally they're in a shock, as you can imagine.
You're absolutely correct about that. And one of the qualities of all lasers are if you get to something that is acute, like an accident, right away, your healing increases by, I would say, at least 3 times as fast. So that's a very, very good point that you're bringing up. Absolutely. If you're in an accident or if you slip and fall or hurt yourself, or even right after surgery, I'm talking to several doctors right now that do knee surgery, and sometimes the patients develop a lot of scar tissue or inflammation. So I'm trying to work together with them to say, you know what, have the surgery, but then have us go home and treat with a laser, and you're going to see that they're going to heal so much faster. And they're really starting to understand this whole concept and saying, they want to start working together. So that's going to be exciting.
I heard about that with oxygen therapy,
correct.
Hyperbaric oxygen, that they want you to help them.
Exactly.
Well, what if someone were perfectly fine, like you?
Okay.
and you use this? What would happen to you?
You can only get better. So obviously, if you don't have any pain anywhere, you don't apply it there. But I have to tell you, I use it for my adrenal glands just because I am a little stressed, working many hours and sometimes not sleeping and just thinking about all the things that go on. So I treat my adrenal glands just to soothe me down, to get me going, the stress, calm that all down. And then I also treat my head area, just because that's very good for anxiety, for stress. I do use it if I come up with a cold. So if I feel I'm coming up with a cold, I will treat right away. And I have not been sick, touch wood, for quite a long time.
You treat yourself for a cold coming
Absolutely.
up.
The minute you feel something tingling, and you can always tell, right? When you're getting something, your throat gets scratchy or your nose starts getting a little bit tingly, I will treat myself right away. I have a specific protocol I kind of developed. It's called the flu protocol, and I treat myself 3 times within 24 hours, and literally your flu symptoms are practically gone. And that's a great thing to have for people at home that use this laser. I give the flu protocol to them, and they all say it's amazing. My mom, actually, she has the laser, obviously, was very, very sick. I told her, do this, do that, do this. She followed everything, and she got over being sick within 3 days, where normally it would take her at least 10. And that's important when you're older. You can't be that sick. The flu hurts a lot of elderly people, and some people can die from it, obviously.
So people who are listening may be saying, well, what are the negatives? Can it hurt me?
Never. That's the beautiful thing. It can never hurt you. There are just, let's say, 2 or 3 things. If you're pregnant, we just say don't use the laser. That's a liability thing. There's just not enough information out there to be absolutely sure. I would use it if I were pregnant, if I were that lucky again. But I'm too old for that. But I just saying, I feel confident enough. My daughter, if she's ever be pregnant, she would use it. I would tell her to use it. So it's not that it's dangerous. It's just more of, we don't know, right? It's not been used long enough to really know the repercussions. But I believe so that it's safe. Then if you have a pacemaker, we just don't treat over pacemakers, just because that is the heart. That is, an electronic piece, so you don't want to mess around with that. So if you have a pacemaker, we have a rule: treat above the neck and below the waist, just far enough from it. And that is really all. You just want to have close your eyes with the home device. You just close your eyes and you'll be completely safe.
You don't have glasses?
You're not with the home device unit. No, it's very, very gentle, very, very safe. You actually have a new protocol that came out for macular degeneration. We have even some studies that show where there was a piece that separated from the eye, and after laser therapy with this device, it attached itself again. And people who have had strokes that have bad vision, after using the laser, their vision comes back. So we can even use this in the eye. There's a physician in Naples who specializes in using this laser for all his patients who have eye problems.
Really?
So even that's going to start to come out.
Well, so many people have macular degeneration. I mean, that's interesting. And so where do you use the laser if they have...
For any kind of eye problem, what we'll do is we'll use it on the carotid artery, because that's an artery that supplies your whole brain, your head, your entire area. So you want to definitely put, good energy into there. Then we will treat the temples, and we will literally treat the eye. So we say, look straight ahead and then look down, close the eye, and we put the laser on the eye itself. And it works fantastic.
I'm sitting here with my mouth open because... that's really a very important issue to older adults.
It is, yes.
And if you believe that there can be some help, it doesn't mean it's going to probably be perfect, but if you can see a little bit better, wouldn't that be great?
Yes, absolutely. And this is a therapy that you can do yourself. It's not difficult or dangerous. And the fantastic thing is I guide you through everything. So when you do purchase a laser, I will be on the phone with you either through Skype, or we'll text, or I'll be on the phone with you, guiding you through how to turn it off, how to, use it, then give you a custom protocol. You tell me what is your problem. I tell you exactly what to treat, tell you what to do. I have texts all the time from patients that say, okay, I heard this, I have that. What do I need to do? And usually I'm in contact with them for about a month to 2 months, and then they become experts, because you realize, this is really easy. I have to go deep into a joint. I put the laser at, 50 hertz. If I'm doing the skin, it's more at 1,000 hertz. So it's very, very self-explanatory and very easy to use.
Yeah, and I have seen them. They're quite small.
Yeah.
They're, I think like a hairbrush almost.
Correct.
I would say something like that. Well, this is such a wonderful interview. Every time you come, when we think we've said it all, there's more. So this is now a whole new thing, Carmen, home care with the advanced laser therapy. And it's wonderful to have you on our show, Leslie.
Thank you.
Leslie Carmen, call her at 561-405-9577. Go to her website, which is carmencarelaser.com. carmencarelaser.com. And they have offices, their headquarters, they are in Boca Raton, but they also will go down to Aventura and Plantation. So if you're feeling pain, please help yourself. Thanks so much.
Thank you.